Rosacea is a chronic skin condition that primarily affects the face, leading to redness, visible blood vessels, and sometimes acne-like bumps. It often starts as a simple flush or blush, but over time, it can become more persistent and lead to other symptoms. Many people describe it as a persistent blush or sunburn that just won't go away. Rosacea often impacts the cheeks, nose, chin, and forehead, but in more severe cases, it can also affect the eyes. Although rosacea is sometimes confused with acne, an allergic reaction, or other skin disorders, it's unique in both its symptoms and progression. This condition often comes and goes in flare-ups, meaning that symptoms might get better for a while and then suddenly come back. Rosacea is more common than many people realize. It's estimated to affect up to 415 million people worldwide, with a higher prevalence in fair-skinned individuals of Northern European descent. However, it can occur in people of all skin types and ethnicities. Rosacea typically begins after age 30 and is more common in women, although men often experience more severe symptoms. Types of rosacea. Rosacea comes in different forms, and people can experience one or more of these types. Number 1. Erythematolangictatic rosacea. This is the most common form, and it involves persistent redness and visible blood vessels. People with this type often experience flushing that can last for longer periods than just blushing, sometimes even hours. Number 2. Papulopustular rosacea. This type is often mistaken for acne, and it includes not only redness, but also swollen bumps and pus-filled pustules. It's quite common for these breakouts to occur in cycles, coming and going in waves. Number 3. Phymatous rosacea. This type is characterized by thickened skin and often affects the nose, which can take on a bumpy, enlarged appearance. It's more commonly seen in men and is referred to as rhinophyma when the nose is involved. Number 4. Ocular rosacea. This type affects the eyes, and it causes redness, irritation, and watery or bloodshot eyes. Some people also feel a gritty or burning sensation, almost like there is sand in their eyes, making it particularly uncomfortable. Causes of rosacea. The exact cause of rosacea remains unknown, but researchers believe it's likely a combination of genetic and environmental factors. There is a genetic element, as those with a family history of rosacea are more likely to develop it, suggesting that inherited factors play a role. Besides genetics, the immune system may also be involved. Some researchers believe that people with rosacea may have an overactive immune system, leading to the persistent inflammation characteristic of the condition. Another potential theory is the presence of a type of mite called Demodex folliculorum. These mites live naturally on human skin and are usually harmless, but in people with rosacea, there tends to be a higher number of these mites, which might lead to increased irritation and inflammation. Bacteria, particularly Helicobacter pylori, which is associated with stomach issues, has also been suggested as a trigger for rosacea in some people. This bacterium produces a protein that can cause blood vessels to dilate, potentially contributing to the characteristic flushing seen in rosacea. Triggers of rosacea. Besides the causes we explained, there are clear triggers that can make symptoms worse. Number 1. Heat and sunlight. Prolonged sun exposure and hot temperatures can lead to flushing. Even hot showers or baths can trigger symptoms for some people. Number 2. Alcohol. Drinking alcohol, especially red wine, is a well-known rosacea trigger. Number 3. Spicy foods. Hot, spicy foods can cause blood vessels to dilate, leading to increased facial redness. Number 4. Stress. Emotional stress or anxiety often contributes to flare-ups. Number 5. Temperature changes. Moving from a cold environment to a warm one, or vice versa, can trigger symptoms. Number 6. Skincare products. Some skincare ingredients, such as alcohol or fragrance, can irritate sensitive skin and lead to redness. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of rosacea. The symptoms of rosacea can vary widely from person to person, but they often begin with a tendency to blush or flush more easily than others. This flushing can feel warm or even burning, and it may spread from the cheeks to other areas of the face. Over time, this redness can become more persistent, lasting for hours or even days. As rosacea progresses, small blood vessels on the nose and cheeks often become visible. These are called telangiectasias, and they can look like thin, red lines just under the surface of the skin. Some people describe a feeling of heat or sensitivity in areas where these blood vessels are visible. Many people with rosacea also develop small, red, acne-like bumps. Unlike acne, these bumps don't have blackheads or whiteheads. They may contain pus and can be tender or painful. The skin may feel rough or dry, and there might be a burning or stinging sensation, especially when applying skincare products. In some cases, rosacea can cause the skin to thicken, resulting in a bumpy texture. This is most common on the nose, leading to a condition called rhinophyma, where the nose appears bulbous and swollen. This symptom is more common in men than women. Ocular symptoms are also common in rosacea, affecting up to 50% of people with the condition. These can include dry eyes, a gritty or burning sensation, redness, and recurring styes. Some people may experience blurred vision or increased sensitivity to light. Diagnosis of rosacea. Diagnosing rosacea is primarily based on visual examination and a patient's medical history. There's no specific test for rosacea, so doctors typically rely on recognizing the pattern of symptoms. They'll look for the characteristic redness, visible blood vessels, and bumps on the face. They'll also ask about symptoms like flushing, burning, or stinging sensations. Your dermatologist might use a device called a dermoscope to examine the skin more closely. This can help differentiate rosacea from other skin conditions that might look similar, such as acne or lupus. In some cases, a skin biopsy might be performed to rule out other conditions. Your doctor will also ask about potential triggers, family history, and any other symptoms you might be experiencing, including eye symptoms. So, it's helpful to keep a diary of your symptoms and potential triggers before your appointment. Treatment for rosacea. While rosacea doesn't have a cure, a variety of treatment options can help manage symptoms and improve the appearance of your skin. The right treatment depends on your type of rosacea and severity, so it often involves a bit of trial and error to find what works best for you. Number 1. Topical medications. These are often the first line of treatment for rosacea. Medications such as metronidazole or azelaic acid can be applied directly to the skin to reduce inflammation and redness. Some newer topical treatments, like brimonidine, help constrict blood vessels to minimize facial redness temporarily. Number 2. Oral medications. Oral antibiotics like doxycycline are sometimes prescribed to reduce inflammation, especially for people who experience bumps and pustules. For more severe cases, isotretinoin, a powerful acne medication, might be considered, but it's usually used only when other treatments have failed. Number 3. Laser and light therapy. Laser treatments can help minimize visible blood vessels by using light to target and shrink them. This type of treatment is particularly effective for people with prominent blood vessels or persistent redness. Multiple sessions may be needed, and results can last several months or even longer. Number 4. Skincare routine. A gentle skincare routine can be beneficial in reducing irritation. Use a mild, fragrance-free cleanser and be careful when applying any skincare products. Avoid harsh exfoliants or anything with alcohol, which can worsen redness. Moisturizers designed for sensitive skin can help soothe irritation and keep the skin barrier healthy. Number 5. Lifestyle changes. Avoiding triggers can be one of the most effective ways to manage rosacea. This includes wearing sunscreen daily, avoiding harsh skincare products, and using gentle, non-irritating cleansers and moisturizers. Protective measures such as wearing a wide-brimmed hat and avoiding direct sunlight during peak hours can prevent flare-ups. Also, minimizing stress, avoiding spicy foods, alcohol, and caffeine, and managing heat exposure can help control symptoms. Number 6. Eye care for ocular rosacea. For ocular rosacea, warm compresses and gentle eyelid scrubs can help relieve symptoms. In some cases, doctors may prescribe eye drops or oral antibiotics to control inflammation. Frequently asked questions about rosacea. Number 1. Is rosacea contagious? No, rosacea is not contagious. You cannot catch it from someone else, and it doesn't spread through contact. It's more about genetics, immune response, and environmental factors than anything infectious. Number 2. Can rosacea go away on its own? Rosacea tends to be a chronic condition, meaning it won't just disappear on its own. However, symptoms can vary over time, with periods of flare-ups followed by periods of remission. With proper management and treatment, many people can significantly reduce their symptoms. Number 3. Can diet affect rosacea? Yes, diet can play a significant role in triggering rosacea. Spicy foods, hot beverages, and alcohol, especially red wine, are common culprits. Some people also find that acidic foods like tomatoes or citrus fruits can make their symptoms worse. Number 4. Is rosacea related to acne? Rosacea is sometimes called adult acne because of the bumps and pustules that appear on the skin. However, it's different from traditional acne, which involves clogged pores and blackheads. The causes, triggers, and treatments of rosacea differ from those of acne. Now, we want to hear from you. Have you experienced rosacea or know someone who has? What have you found to be the most helpful strategy for managing flare-ups? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.